Welcome to this mini lecture about the importance of communication. I'm Dr. Catherine Miles, and today we're just going to take a brief look about what is communication and why it's important. So whether we realise it or not, we are continually communicating with people around us. And it may feel that we can't understand them, or sometimes they don't understand us. There can be problems with communication. So today we're going to really look at some of the big questions about what is communication and try to discover some of the answers. So firstly, what is communication? Well, the Oxford English Dictionary says that communication is the imparting or exchanging of information by speaking, writing, or using some other medium to successfully convey or share ideas and feelings. So really, we are sending and receiving information between places and people, and it needs to have a sender, it needs to have a message, and it needs a recipient, someone to receive that information. And often it can be a two-way process. So at the moment, I'm recording this lecture and I am speaking as if you were there listening to me, but I can't actually see you or hear you. Whereas if we were in a lecture hall, I would be able to speak to you, I'd be able to see you, I'd be able to see your response to what I'm saying. I could even ask for participation and for you to join in and contribute things. So there will be a two-way process of communication. And that might sound quite simple, but unfortunately communication can often be more complex. There can be some barriers to good communication. And communication can also be affected by many different things. So for example, our emotions, how I'm feeling, can affect how I communicate. The culture that I'm from can affect the way that we communicate. For example, I am British, and one of the ways we communicate is very directly. So if I don't want to do something, I will tell you, no, I don't want to do it. Whereas here, in Jordan, often communication is more indirect, which means that somebody might not tell me no, they might say, oh, inshallah, meaning no, but they say inshallah, maybe, God willing, because they don't want to tell me no. And again, the context that we're in can affect our communication, and actually the medium that we use, which means what we're using to communicate, can affect how effective that communication actually is. So what is the aim of communication? Why do we even want to communicate things? Well, we want mutual understanding between us. And how do we communicate? Well, one of the first ways we communicate often is verbally. So that means by what we say, using our words, speaking. Another way we communicate is non-verbally. So that's things like our appearance, our body language, our gestures, also how we look. Another way is written. So for example, notes, written words, text, these things can communicate. And then lastly, we also communicate by visual means. So that can be things like images, pictures, charts, paintings, maps, all sorts of different ways that we can visually look at something and it can communicate something to us. And we can use a number of different mediums to communicate as well. So that means things like face-to-face communication. We can use computers and tablets, giving presentations, video conferencing. We're all getting very used to using things like Zoom, Microsoft Teams because of the problems with coronavirus. We can use our mobile phones, the internet, television, radio, books, pictures, magazines. There's so many different ways that things can be communicated. Now, there has been some research done about the percentage of information that is communicated by our body language, by the tone of our voice, and by the actual words that we use. So can you guess how much information do you think is communicated by each of these things? Well, 7% of what we communicate, the information, is actually only by our words. You maybe would think that our words contribute more information. What about 38%? 38% of what we communicate is actually by the tone of our voice, what our voice sounds like. Do I sound very sad, very boring? Or do I sound enthusiastic, happy, interested? So that can communicate things, the tone of our voice. And then this last 55% is communicated by our body language, by our gestures, how we look. However, this research is not actually as robust as it may seem. Many people may say, oh, these are the golden rules of communication, that actually our words are not so important as how we sound and how we look. But the research was done by Professor Mehroban, and actually it's an oversimplification. It was actually only 2 studies that he conducted, and about participants listening to specific words and then drawing conclusions from them. So actually, this research showed that when communication messages are not clear, when they are unclear or inconsistent, then actually the tone of the voice or the body language more accurately portray the meaning or the emotion than the words do. So that's really saying when communication is a bit unclear, then actually the body language and the tone may be a more accurate representation of what's being communicated than the words. So the research is not actually saying that words aren't important or don't communicate much information. They do, but when the communication messages are unclear, then these other things actually can be more important. So just have a think for a moment. Who do you currently communicate with? In your day-to-day life, who are you communicating with and how? Possibly verbally by what you say, or non-verbally, even as you walk along the street, you may be communicating to the people around you if you're happy or if you're sad or angry. So maybe you're communicating with your family members, your friends. On campus, you may communicate with your tutors, administration staff, even cleaners, and if you're at home, neighbours, shopkeepers. There's many people that we are communicating with. Now let's think, what about if you're a doctor in hospital? Who then will you be communicating with? So maybe it will be other doctors, patients, other medical students, or even the patient's relatives. We know here that often there can be big families, the whole tribe, al-qabila. You may be communicating with other healthcare staff, nurses, physiotherapists, radio therapists, cleaning staff, administration staff. So why is good communication actually important? Why does it matter that we communicate well with people? Well, as we said, we want this mutual understanding. And as we talk to patients, we need to really understand them so that we get an accurate diagnosis of the problem that they have and that we can accurately explain to them what the diagnosis is and what treatment they need to follow. So research has shown that good communication makes consultations more effective. That means that we actually communicate what we want to, and it's understood by patients, and equally patients communicate more effectively with us. Consultations are also more efficient. You may think that as we listen to patients, that may take more time, and actually we don't have a lot of time to talk to our patients. but actually using different communication skills can help to make consultations more efficient, that it actually takes less time to gather the amount of information we need. It also helps with patient satisfaction. Patients are happier with the consultation and change doctors less frequently if their doctor uses good communication skills. It can also help with doctor satisfaction. Doctors are happier and more satisfied with the consultations, with their work. They can be less burnt out and experience less stress in their lives. It can also lead to better health outcomes. We want our patients to be healthier. We want to understand, why have they come to see us today? What problems are they experiencing? What is the diagnosis? And actually to communicate with them to help them understand the diagnosis and to follow the treatment plan more effectively. So these are some of the reasons why communication is so important, and so important for you as medical students to learn good communication skills so that you can better help your patients and make your consultations with patients more effective, efficient, more satisfying, and with better health outcomes. So these are just some of the references from today, but hopefully you can see that even when you may have some difficulties and challenges communicating with others, and maybe other people don't understand you, that learning and using communication skills and understanding communication can help you to convey messages in this sharing two-way process. This will be especially helpful now as you are medical students, but also as you graduate and become doctors, so that you can help your patients. Thank you very much.